So if we get straight into the questions, from your clinical experience, which clinical tests or signs have consistently proven to be the most accurate or useful when identifying the source of low back pain?
Accuracy and useful are not the same thing necessarily. Accuracy has very, very specific statistical meaning, basic, and it's measured in terms of sensitivity, specificity, likelihood ratios, and all those statistical things. And that's how we measure accuracy. And it's always considered to be in relationship to a superior standard, which we call a criterion standard. So you have a test that we do in a clinic, and what is the value of testing that test in relation to some superior standard to the test, which is known to make a diagnosis. And it may be that it could be a particular test, like a diagnostic block, or it could be something like spinal stenosis, where there's no single test that you could say that's the gold standard, if you like, or what I call a criterion standard. It's a combination of imaging and the history. That's the gold standard. The criterion standard is a combination of things done by an expert who's able to put these things together. And the question is, if you're going to say, is walking distance a good test for spinal stenosis? The answer is not in terms of diagnostic accuracy, because lots of things limit your walking, all right? Like you might have an ankle sprain. So just that in itself doesn't mean much. It's all right. So, but is it useful to ask the question, is your walking distance limited? The answer is absolutely. And it is particularly useful for people who have stenosis. But it's also particularly useful for people who have vascular claudication as well.